Hello, my name is Kathleen Lisson. I am a lymphedema therapist. I have a practice in San Diego, California, in the United States, and I am talking to you today about my thoughts about attending the ISL 2023 Congress. It was in Genova, Italy in September 2023. So one of the greatest things about going to this international conference was the fact that I was able to see people that I've only met in academic journals. I've learned from them, I've read their writing, I've read their research, I've used their research to help my clients have better results, and it was so exciting to actually get to see some of these people and see them present their research in person. Also, another really great thing about going to an international conference is that you can listen to perspectives from experts from around the world. And I love to kind of put my perspective of a therapist that is in Southern California into my presentations because we enjoy meditation in Southern California, we enjoy yoga in Southern California, and stress reduction is a topic that we definitely talk about. So it was really great for me to go and present some things on stress reduction from a Southern California perspective and share research with people from around the world. I also got to have my kind of worldview enlarged by some concepts. And the first concept was the concept of exercise. So as a result of attending this conference, my new kind of catchphrase is exercise is ABC. So exercise is not just, something we hated to do in high school and we kind of force ourselves and our patients to do with lymphedema. But I like to say ABC, like aquatic, breathing, and calming, because breathing exercises are very important. Calming, stress reduction exercises are very important. And I was able to go for a couple hours to see so many different presentations on the power of water, specifically and including aquatic therapy. And I was so happy to meet one of the researchers that I shared his research in the book, Stress Reduction for Lymphedema, and his protocol for aquatic exercise. So I've kind of expanded when I say exercise is part of self-care for lymphedema. I'm talking about aquatic exercise, breathing exercise, calming exercise, mind-body exercises, and anything as far as a movement practice that the client enjoys and is comfortable with and will do on an ongoing basis. Another really great concept was being able to meet some of the people who wrote the research on things that you should add to CDT to improve patient results. So thinking in particular of one study that I really enjoyed looking at, which was adding a 20-minute session of bicycling, recumbent bicycle, after they were wrapped as part of their CDT actually had a benefit to the clients. And I was able to actually ask some questions of the researcher who came and presented her research. And so my first question was, well, when someone's on that bicycle for 20 minutes, is it going to add time onto the treatment because you're having to rewrap them afterwards? And she said, nope. The bicycle, how that protocol was, they were able to get the exercise in without making the wraps loose. And then they were able to go home and be properly wrapped even after their exercise session at the PT's office. So it was very exciting to learn some of these add-ons to complex decongestive therapy that will help get a better result for our clients. Two more super interesting concepts, ultra high frequency ultrasound and how it can visualize individual lymphatic vessels, and then seeing the lymphatic vessels work in real time can help the surgeon select the correct and best lymphatic vessel for lymphatic surgery. And then also robotic surgery, as the surgery fields are getting smaller and smaller, Humans have a tremor in their hand, which was formerly limiting how small that they could get with surgery. But now that they're able to incorporate robots into the surgery, that eliminates the tremor, which can give even more possibilities for these surgeries in the future. Some really interesting research that I saw that I think I'm not going to be able to explain in just words until it's more widespread and you can see pictures of it, is the concept of the lymphatic. There's an image for lymphatic pumping, and as lymphatic pumping is not so effective in the body because the body starts getting lymphedema, some kind of lymphatic dysfunction, we can see it in lymphatic pumping in much the same way that if you put leads on someone, you can read their heart with the symbol. There is also this kind of symbol that symbol is not the right word, but there's also this kind of imaging that can show you how effectively the lymphatic vessel is pumping. So that I think I'm going to be at a loss of words to explain it if you don't kind of get it. Like there's a QRS symbol in the heartbeat. Similarly, there is a lymphatic vessel beat as well. Cervical lymphatic surgery, I kind of buried the lead for this video till like the 6-7 minute mark. This is going to be the hottest thing that we are going to hear in the next 5 years. You're going to start hearing about it, I think, in 2024 and 2025, and it is going to be huge, and everyone is going to be lining up because limited amount of surgeries have already been performed successfully on humans. And so American surgeons are really looking into this. They're trying to get trials with mice, and then they're trying to go into human trials. And eventually you will be able to do a surgery on the cervical lymphatics that will affect the symptoms of Alzheimer's, the symptoms of dementia, the symptoms of Parkinson's. So that's going to be the big, huge news in the lymphedema surgery world in the next few years. And this the first time that I actually got to see a full presentation on it and see video of someone who had had the surgery, and the before and afters were stunning. It's going to be life-changing for families. And then the two negatives, the two things that give me pause that I learned during the conference. The first one is that unfortunately language is still a barrier. We are publishing, researchers are publishing research, but if they publish it in a language that other researchers cannot understand, that research is not getting diffused out to the community, and everyone is not able to learn everything that they should be learning, and that the language barrier is still slowing down the pace of innovation in lymphology, and that's an ongoing problem that we still have in 2023. And then the final point that I kind of learned, because we were learning so many different things and I was exposed to so many different perspectives, is that my concept has expanded. So now my opinion is that a well-rounded CLT, if we're going to say that we're a lymphedema therapist, we should have expertise, resources, if not personal expertise, in all different applications of lymphedema treatment for the client. So we don't have to, not everyone is going to have to be able to help every client, but we should have resources for anyone that comes and asks for different treatments in different presentations of lymphedema. So it's my opinion that as a CLT, I should know how to get you help for your head and neck lymphedema. I should know how to get you help for your genital lymphedema. I should know how to get your children help for their pediatric lymphedema if you come and ask me. And I should know how to get you help and resources if you've undergone surgery for your lymphedema and you need post-operative care. I think that's the true sign of a well-rounded CLT is that we're not just focusing on just the arm or just the legs. We can give you resources, and we know where to send you for help in all these different presentations of lymphedema. Especially, I think, for the post-surgery, I think we should be ready to interact with the surgeon and get the client the help that they need post-surgery and feel qualified and confident. If we're not doing it with our own hands, then with the person that we refer them to. So that is my recap of the things that I learned, the things that were most interesting to me from the 2023 meeting of the ISL. Thanks so much.